In this section of the presentation, I'm going to cover the preventative measures of injury. Primary prevention is preventing injuries occurring in individuals or team sports. Secondary prevention is working with an injured athlete and working out how to reduce further injury or re-injury. Any approach to preventing injuries should be well informed, logical, and have a use of framework. One of the most important roles of a sports injury practitioner is to prevent injuries and thus the physical, mental, and social harm that goes with them. In this section, I'm going to cover a secondary prevention, injury prevention, and this would be the Van Mechelen et al. 1992 model, in which principles of injury prevention. Here is a diagram of the Van Mechelen 1992 injury prevention model. This four-step model of injury prevention suggests a cycle of stages, going from establishing the injury problem to ultimately evaluating if the preventative measure has been effective on the number and type of injuries. So first of all, in stage 1 of the Van Mechelen model, you have to establish the extent of the problem, in which you have to establish the extent of the prevalence of the injury, the severity of the injury, and the timing of the injury. Once that has been done, you then go on to stage 2, in which you establish the etiology of the injury, in which there are two factors, one being intrinsic factor and one being extrinsic factor. Both of these factors are the root cause of the injury. Once the etiology of the injury has been established, you then go on to stage 3, in which you introduce a preventative measure aimed at reducing the incidence of the injury. And then finally on stage 4, you evaluate the effectiveness of the preventative measure, which is stage 3, by repeating step 1 of the process. I'm going to apply this injury prevention model to a 400-meter sprinter who suffered from a grade 3 hamstring tear and is known by the name of Derek Redmond. So stage 1 of the Van Mechelen model is establishing the extent of the problem. Firstly, the extent of the sports injury problem should be identified and described. In sport, an athlete can obtain two types of injuries, one being an acute injury and the other being an overuse injury. According to Dr. Kevin Yip, 2008, acute injury is a sudden injury that is usually associated with a traumatic event, such as clashing into another player during the sports or a fall from a bike. Moreover, according to John Miller, overuse injuries refer to injuries sustained from repeated action, such as repetitive strain injury. When establishing the extent of the problem, there are three components which need to be taken into consideration. So the first one being the severity of the injury. Out of the two types of injuries, acute injuries tend to be more severe as they are associated with traumatic experiences which could possibly even scar someone for life. Acute injuries tend to be much more painful and it is difficult to cope with them. For example, Derek Redmond suffered from a grade 3 hamstring tear whilst performing a 400-meter sprint, and this was a very traumatic and painful experience for him as he completely ruptured his hamstring muscle, and as a result it ended his career. As Derek Redmond stated, "When I saw my doctor, he told me I'd never represent my country again." Moreover, overuse injuries, on the other hand, tend to be less severe and athletes would be able to cope with them more easily as they are not often associated to traumatic experiences, neither are they too painful. The timing of injuries should also be taken into consideration, and out of these two types of injuries, both injuries can take time. Overuse injuries can take long because oftentimes, if the athlete returns to their sport and begins to utilize the affected limb, the injury can often return, which can delay the progression of their performance. For example, an endurance athlete such as a marathon runner may suffer from shin splints due to running for prolonged periods of time while striking their heel on the ground. Even after 2 months of rest and returning to the sport, the overuse injury can return again if the athlete does not be careful and if they start intense exercises too soon. Acute injuries can also take longer to rehabilitate due to the severity of the injury. Acute injuries often require the injured athlete to rehabilitate not just physically but mentally also, as the experience can be traumatic. And as a result of this, the athlete can face negative emotions such as depression because they may begin to feel that they won't be able to progress their performance due to the injury they are bestowed with. For example, Derek Redmond stated after his injury, "I felt like there'd been a death. I never raced again and I was angry for 2 years." Later on in time, he stated, "Today I don't feel anger, just frustration. This indicates that Derek Redmond is going through various stages of the grief response model, as he's shown signs of anger, depression, and he also begins to accept reality, as he states, "Then one day I just thought there are worse things in life than pulling a muscle in a race, and I just decided to get on with my life." Finally, the prevalence of the injury is a factor which also needs to be taken into consideration. Prevalence of the injury is how frequent an injury occurs, and generally, out of the two types of injuries, overuse injuries are more likely to occur, hence the term overuse. Overuse injuries can keep returning once the athlete returns to their sport, if too much stress is applied to the affected limb or if a sudden movement is applied. When an athlete encounters an overuse injury, it's best for them to avoid playing at competitive level and rather play in light to moderate exercise to strengthen the area which is affected. Furthermore, acute injuries such as Derek Redmond's grade 3 hamstring tear will have left Derek's hamstring much weaker, and even though he obtained successful rehabilitation, his hamstring is still prone to pulling again. This indicates that if the hamstring is prone to pulling again, even acute injuries can frequently return, resulting them to become an overuse injury. Moreover, an advantage of establishing the extent of the problem is that the athlete would be able to determine what level of treatment they will require. By assessing the extent of the problem, they won't underestimate the injury and they can develop a rehabilitation program whilst taking these factors into consideration. For example, if the injury is prevalent, such as an overuse injury, then the exercise in the rehabilitation program would be light to prevent the aggravation of the injury. A disadvantage of not establishing the extent of the injury would be that the athlete might not feel pain, so they would think to themselves that they are fine, when in reality they aren't, and they can aggravate the injury and make it worse if they continue to play with their sport. For example, Derek Redmond stated, "I got into my stride running around the first turn and I was feeling comfortable. Then I heard a popping sound. I kept on running for another 2 or 3 strides, then I felt the pain." When Derek began to feel uncomfortable, he should have immediately stopped and established the extent of the problem and identify what type of injury he is going to have if he carried on, and if he did do this, then he wouldn't have suffered from a grade 3 tear. This stage of the Van Mechelen model is significant because without establishing the extent of the problem, then the athlete would not have an idea of how to treat the injury, or they could possibly underestimate the injury, thinking to themselves that their injury is not too serious, so they should continue to play sport just as Derek Redmond did, and he ended up suffering with a grade 3 hamstring tear, which ended his Olympic dream. The next stage of the Van Mechelen model is establishing the etiology of the injury. It's important to establish the etiology of the injury. There are 2 components within this stage, one being intrinsic factors and the other being extrinsic factors. Intrinsic factors are factors which originate within the athlete's body. Extrinsic factors, on the other hand, are factors which originate outside the athlete's body. The reason why it's important to establish the etiology of the injury is because by doing so, the athlete will know the main cause of the injury. For example, when Derek Redmond suffered grade 3 hamstring tear during the 400-meter sprint, he was able to identify that the main reason as to why he suffered from this acute injury was because he applied excessive volume intensity during the first 100 meter of the sprint, which was the main reason why he suffered from the grade 3 hamstring tear. This means that the etiology of the injury would be an extrinsic factor, as the problem is external from the body and it's mainly because of training error, which is an extrinsic factor. By establishing the etiology of the injury, the athlete would be able to know what was the root cause of the injury, and by identifying the root cause of their injury, they can make sure that the injury doesn't happen again by simply avoiding what they did. An advantage of establishing the etiology of the injury would be that the athlete would be able to identify what the cause of the injury was, and in future they would make sure that this does not happen again, and so the injury would be prevented and the athlete would be more appropriately prepared to perform in the sport. A disadvantage of not establishing the etiology of the injury would be that the athlete would not be able to identify the root cause of the problem. Derek Redmond is a prime example, as he's decided to carry on despite showing signs of injury. As he stated, "I got into my stride running around the first turn and I was feeling comfortable. Then I heard a popping sound. I kept on running for another 2 or 3 strides, then I felt the pain." If Derek stopped and established the extent of an etiology of the injury, he will realize that if he carries on, this would lead to further complications which can end his career, and he would still be competing today if he didn't carry on with the race. This stage of the Van Mechelen model is significant because by establishing the etiology of the injury, then the athlete would be able to introduce preventative measures aimed at reducing incidence of injury, which is stage 3. Without establishing the etiology of the injury, then the right preventative measure cannot be made, because in order to treat the injury, the athlete first needs to treat the cause of the problem, which can only be identified by establishing the etiology of the injury. The next stage of the Van Mechelen model, which is stage 3, are the preventative measures. Many preventative measures vary based on the demands of the sport, the level of competition, and the resources available, and contact time with the athletes. But many individuals are responsible for injury prevention, including the coach, players, sports injury practitioners, referees, sports scientists, and conditioning coaches. It should be a real team effort. Some general preventative measures are covered within this section. The first preventative measure is the role of the coach. The coach has a huge role to play in preventing injuries. A coach should have up-to-date knowledge of the sport and the athlete. This includes monitoring of loading and each athlete's strengths and weaknesses. Derek Redmond stated in his interview, "My dream was over in Seoul for 4 years. 4 years earlier, I didn't even get to the start line because of an Achilles injury." Derek stated that he had an injury on his Achilles tendon, which is a highly utilized tendon in any form of running, especially sprinting, as sprinting requires the athlete to run on the balls of their feet, which places greater emphasis on the Achilles tendon. Due to this injury, this would have affected Derek's running gait, which means that there was a chance that the reason why he torn his hamstring was because of the incorrect technique which he acquired during his Achilles injury, and this technique subconsciously conditioned his running gait. In addition to this, Derek stated, "For once I had no injuries, despite 8 operations in 4 years." Derek also mentions that he has 8 operations within the space of 4 years, which can also significantly impact his performance on the track. These are Derek's weaknesses, which the coach should take into consideration, and the coach should have aimed to correct Derek's running gait and perform exercises which strengthen the Achilles tendon. A coach should also have up-to-date qualifications. In this scenario, it's essential for the coach to have an up-to-date first aid certificate where the coach knows how to conduct a primary survey, secondary survey, and perform CPR. By having this qualification, the coach would know how to deal with any situation, whether it is life-threatening or not, and be able to apply the appropriate procedures depending on the injury. For example, as Derek Redmond suffered a grade 3 hamstring tear, the coach would immediately perform a primary survey to monitor the athlete and to see whether they are having a life-threatening condition. Since Derek's injury isn't life-threatening, the coach should skip the secondary survey, which is only performed if an unconscious person is breathing, which Derek wasn't, and go straight onto sports injury treatment, which includes the RICE protocol, which is an acronym for rest, ice, compression, and elevation. All this knowledge would only be achieved and is only allowed to be performed if the coach has an up-to-date qualification in first aiding. The reason why the qualification must be up-to-date is because oftentimes people forget the procedures of first aid, so the first aid certificate must be repeated every 3 years to ensure that the coach does not forget on how to apply the procedure. The next preventative measure is equipment and environment. A thorough risk assessment of the training and competition environment must be conducted. It's important to go through this procedure for the equipment that is used. For example, protective equipment. In many sports, protective equipment has changed dramatically as technological advances in the materials available and biomechanical analysis techniques. Research and analysis of movement have allowed improvements in quality. Advances have been in both protection on playing and on-playing performance. So, protective equipment has changed dramatically as technological advances in the materials available and biomechanical analysis techniques, such as excess weight of the protection, is one factor which, because of technology, excess weight of the protection and decreased range of motion which can be caused by the protection. Because technology advanced, new protective equipment can be developed which is lightweight and does not decrease the range of motion, which is beneficial for athletes because oftentimes if they suffer from an injury, they may need to wear protective equipment, and if the equipment is too heavy or can affect range of motion, this can affect the athletic performance. Moreover, because Derek Redmond is vulnerable to injury due to his Achilles tendon injury and his 8 operations in the space of 4 years, he should have worn a protective equipment around the Achilles tendon, such as a compression band, to keep the tendon compressed so that the Achilles tendon functions properly and does not function beyond its coping point that it snaps again. Also, after Derek suffered from his injury, he should have used crutches to help support him to walk. Otherwise, Derek would be unable to walk without any support, and as a result of this, the muscles of his legs would become weaker due to too much bed rest. Sports players need to ensure that any sport-specific or specialist protective equipment is used correctly. If it's used incorrectly, this can be a hazard, putting the wearer and other athletes at risk. When using different types of protective equipment, you should always ensure that the equipment is thoroughly checked prior to use. Not make any modifications to the equipment. Use the equipment only for the sport for which it's designed. Use only the correct size. Be aware that protective equipment does not make you invincible, and use the equipment for both practice and competition. Furthermore, environmental conditions should also be taken into consideration to help prevent the risk of injury. For example, a training session that is held on grass might reduce the risk of an injury occurring compared to with holding the same training session on a hard or artificial surface. And if weather conditions change, perhaps with rain making a surface slippier, then the session could be moved so that it is held indoors. The next preventative measure is performer preparation. If Derek properly prepared himself before taking part in training and competition, then the chances of his injury would have reduced. An effective warm-up should prepare Derek to work at the game pace. A good warm-up should follow the RAMP acronym, in which R stands for raise, which is raising the blood flow, breathing rate and heart rate. A stands for activate, in which you activate key muscle groups using dynamic stretches. M standing for mobilize, in which you mobilize the major joints, and P standing for potentiate, in which you potentiate muscles to improve effectiveness through jumping and landing, sprinting and cutting movements. An athlete who has been sat or stood still for a period of time, for example a substitute in a football match, should be encouraged to re-warm up. All athletes should also take part in a cool down after training or competition. Measured to improve flexibility should be done on most days. These measures to improve flexibility should be done on most days. These measures only work if they are done on a regular basis. This could include stretching, foam rolling, or having a regular sports massage. The next preventative measure would be appropriate training. Athletes should be appropriately trained to meet the demands of the sport and have an effective recovery after training and competition. This means following a periodized training without rapid increases in the frequency, duration, intensity of type of training. One way to prevent the onset of injury, especially for Derek, would be to perform strength and conditioning for Derek's Achilles tendon and hamstring. An example of how we can do this is by using resistance bands and performing plantar flexion with resistance, and also Derek can perform concentric and eccentric and isometric movements for his hamstring to strengthen them. Even after Derek's grade 3 hamstring tear, he should still aim to perform strength and conditioning for his hamstrings to ensure optimum rehabilitation of the hamstrings and so that they regain their strength. Moreover, Derek should also aim to develop core stability for greater postural control. If Derek trains whilst concentrating on his core, then the chances of him injuring himself would diminish significantly, because the core is the bridge between the upper and lower body, and oftentimes it's neglected in strength training. By developing core strength and stability, Derek would sprint with the correct technique and all the muscles of the lower and upper body would be cooperating effectively. So as you can see on the two pictures, the picture on the left is a picture of Michael Johnson, who's a 400-meter sprinter, and the picture on the right is a picture of Usain Bolt, who's a 100-meter sprinter. As you can see, Michael Johnson has the incorrect form. Because he's running the 400-meter sprint, it's highly demanding on energy, so in the last 300 meters of the sprint, the lactate energy kicks in, and because of this, because the energy is so demanding, this affects the running form, and as a result of this, for Michael Johnson, the way it affected him is that it resulted in having an anterior pelvic tilt, so there's an excessive arch in his lower back. By this happening, Michael Johnson is vulnerable from suffering from a hamstring tear, because due to the anterior pelvic tilt, This places greater strain on the hamstrings, and the quadriceps are doing less of the work. So the anterior pelvic tilt while sprinting can cause muscular imbalance and can often lead to injury. Usain Bolt, on the other hand, has the perfect running form where as he keeps both his abdominals and his lower back flexed. So as a result of this, the torso of the body remains upright without any excessive arch, and all the muscles are equally collaborating, which reduce the chances of injury. Correction of biomechanical abnormalities is another preventative measure of stage 3. Every athlete should be screened to identify any potential abnormality that could lead to injury. For example, screening athletes for adequate range of motion at major joints, too little or too much, limb length discrepancy, for example leg length, posture, gait analysis, and assessing the quality of fundamental movement patterns will highlight any issues that might need to be resolved. This may then lead to the athlete needing one-to-one strength and conditioning training with a coach, and to engage in a program of suitable core stability training or stretching. In addition to this, Derek should also aim to develop core stability for greater postural control. This is crucial for any sprinter because sprinting events require athletes to keep their core tense and firm whilst keeping everything else loose. By keeping the core stable, this will prevent incorrect posture while sprinting and ensure that the center of gravity is in the right position to allow the sprinter to accelerate to the best of their performance. If the core of a sprinter is weak, then this can have drastic effects on performance and can also contribute to the tearing of the hamstrings, resulting in problems such as an anterior pelvic tilt. Derek Redmond should have included lots of core strengthening and stability exercises in his training program, because if the core is not tensed while sprinting, then over time the athlete will become tired and their form would diminish towards the middle end of the phase. So as you can see, as I stated before, Michael Johnson's coming towards the last 100 meters of the sprint, and his form has the correct form has diminished drastically. So he's vulnerable to injuring himself at this phase of the race. Anterior pelvic tilt causes more strain on the hamstring because this arch causes the hamstring to function beyond its range of motion, resulting in injury. So this is the arch that I'm referring to, just above his glutes in his lower back. The excessive arch of the lower back means that Michael Johnson is tensing his lower back too much, and he's not tensing his abdominal rectus. Rather, his abdominals are stretching out, and this causes an imbalance between the anterior and posterior regions of the body, which means more muscles will be placed under stress compared to other muscles, which can lead to injury. By keeping the core tensed, both the abdominals and lower back muscles will be contracted, resulting in a straight posture, such as Usain Bolt's, which is the correct running form, and all the force will be equally balanced between all the muscles so they can all cooperate effectively and efficiently. Derek should also have aimed to perform stretches mainly for the muscles of his lower limbs, specifically his calves, hamstring, glutes, and lower back, as all these muscles are located in the posterior region of the body, and all these muscles being stiff could have contributed to Derek's hamstring injury. Derek should have combined his core stability training with stretches to ensure that the lower limbs are functioning to their optimum ability. By stretching the muscles, this slightly lengthens them and prevents them from tearing, as they have an increased range of motion. So just in case if Derek does go beyond the range of motion he should be going, then the chances of him injuring himself are much less. Derek should also aim to perform these exercises on a regular basis, because over time flexibility and strength eventually diminishes if the muscle is not utilized. Finally, other measures which are other preventative measures which can be used to reduce the chances of injury. Taping and bracing may prevent injuries through correcting biomechanical issues by providing stability to the joints or addressing muscle weakness and tightness. If Derek Redmond applied kinesiology tape to his hamstring muscles, then this would have prevented the chances of him developing an injury to the hamstring muscle. The kinesiology tape provides support and stability to the muscles and joints without restricting the body's range of motion, and in addition, it's lightweight, so this would be beneficial for an athlete to use to prevent any muscle damage. So as you can see on diagram on the side. This is what a kinesiology tape looks like. As you can see, it looks like a tape that just you attach to the injured muscle or joint area, and it's lightweight and it does not affect the range of motion, so it's essential and beneficial for any athlete to use, as this would not affect their this wouldn't make them feel uncomfortable, neither would it affect their form or technique. Moreover, ensuring nutrition is another preventative measure. Ensuring that Derek's diet contains plenty of energy facilitates adequate recovery, and making sure that he's fully hydrated would prevent him from suffering from an injury or illness. Because Derek's event is the 400-meter sprint, it requires high energy demands, as a 400-meter sprint requires the athlete to sprint the whole lap around the track, which is highly demanding on hydration and adequate nutrition. If Derek does not consume the right nutrition, then he will not have sufficient energy for the event, and as a result of this, he is likely to have less energy, which further leads to fatigue, and fatigue is a common cause of incorrect form, and as a result of the incorrect form, the chances of injury increases significantly, as the running gait would be affected because the athlete would not have the right nutritional energy to be able to sustain the perfect form throughout the whole sprint. Furthermore, Derek should aim to consume around 3 litres of water daily, and if Derek doesn't consume this much amount of water, then the chances of his injury also increase significantly, because according to Simon Kidd 2016, a reduction of just 2% of fluid can result in degraded performance by as much as 10 to 20%. Furthermore, by not being adequately hydrated, ATP within the muscles, which is adenosine triphosphate, would not effectively break down to release energy, further leading to a decreased lactic threshold, which means that the lactic acid will build up more earlier, which can contribute to injury. In stage three, we're now going to assess stage 3 of the injury prevention model. So an advantage of identifying the principles of injury prevention would be that the coach would have many preventative measures in hand to use on Derek Redmond to reduce the chances of injury from occurring. Furthermore, another advantage would be that more than one different aspect of preventative measure is covered. So if one preventative measure isn't as effective, then the coach can still use a different preventative measure to reduce the chances of the injury from occurring. A disadvantage, on the other hand, for not using preventative measures would be that the coach will not be able to prevent any injuries from occurring in the future, and therefore the chances of the injury from happening again would be high. In addition, a disadvantage of the Van Mechelen model would be that even after following the 4-stage process of the model, there still is a possibility that the injury may not have fully rehabilitated, or the chances of the injury to return again are still possible. Moreover, this stage of the Van Mechelen model is significant because without this stage, the athlete would not have an effective rehabilitation, and the whole purpose of this cycle is to introduce a preventative measure which is aimed at reducing the incidence of the injury. By not introducing preventative measures, the injury would happen again, because this preventative measure addresses the root issue by helping to resolve this issue so that the same injury does not occur again. Therefore, this stage is highly significant within the Van Mechelen model. Finally, going on to the last stage of the Van Mechelen model, which is stage 4, in which you evaluate the effectiveness of the preventative measure by repeating step 1 of the process. So finally, coming towards the end of the Van Mechelen model, it's essential for the coach to see whether applying the Van Mechelen model to Derek Redmond's injury was successful, and in order to do this, the coach should repeat stage 1. Initially, the coach is supposed to establish the extent of the injury by assessing the prevalence, severity, and timing of the injury. After doing so and going through the Van Mechelen model, once the coach reaches stage 4, they should repeat stage 1 to see if there is a difference after the preventative measure has been introduced. For example, the coach should see if there's a difference in the severity of the injury after Derek Redmond's hamstring injury, and then see what the difference would have been like if the coach introduced the preventative measures before the injury had happened. If there's a difference, then this shows that the preventative measures were highly effective in reducing the chances of the injury from occurring. An advantage of the effectiveness of introducing injury preventative measures would be that the likelihood of injuries from occurring would lower significantly, because by introducing preventative measures, whatever injury the athlete is vulnerable to suffer from is prevented. Furthermore, another advantage of introducing preventative measures would be that if the athlete is vulnerable to a certain injury, that happened earlier on in their career, then they wouldn't have to worry about the injury from happening during the competition, and this can boost their performance. Because if an athlete like Derek Redmond worried about his Achilles tendon, it's likely that he won't try his best in case he re-injures the tendon due to the excessive force being applied during sprinting. A disadvantage, however, towards the effectiveness of the Van Mechelen model is that there are criticisms that revoke this model. According to the British Journal of Sports Medicine, Van Tigelen criticises that the execution of this model has been shown to lack validity in determining the success of a preventative measure. A modified model has therefore been proposed which incorporates additional steps that enable the inclusion of external factors with a significant effect on the outcome of a prevention intervention. This expansion of Van Mechelen's model leads to a more global model in which the compliance level and risk-taking behaviour of the individual and the assessment of efficiency of the stakeholders have a key influence on the preventative measure. This stage is significant in the Van Mechelen model because it helps the coach to identify what preventative measures are effective in reducing the chances of injury from occurring in future, and if the preventative measures were successful, then in future the coach should make sure that he applies these preventative measures to Derek Redmond to ensure that the chances of his injury do not reoccur. In conclusion, all the aspects of the prevention model for sports injury are important to be able to identify what the root cause of the injury was and how it can be prevented, and whether the prevention is effective or not. By combining all 4 stages of the injury prevention model, the chances of the injuries that the athlete is vulnerable to have will be prevented more effectively, and the athlete can develop and progress their performance in their sport without any hesitation and worries.